All right, well, let's talk a little bit about insects, bugs, and various types of critters. We'll be having some other folks come in here shortly to talk to you about Lyme's disease and rabies and the particular questions that you may have related to your own personal health. So most of us, when we go out into the field, if we're going out in the field, and it doesn't even necessarily have to be a field with high grass, we're going to come in contact with some sort of insect or bug. Wasps and bees are what seems to be a lot of your workers' comp claims. I was looking through it during the break. And then ticks. This year, the last couple years have been really, really bad for ticks. And I provided some handouts. I don't know if you guys have seen those handouts. They're there for you to look at. But we need to talk about stinging insects first. Do you have any type, or are you issued or given the option to have sunscreen or bug sprays? Have you been trained on any of that kind of stuff to use or
Michelle?
Mm-hmm.
Hi, it's Jan in Cumberland. Here in our environmental health district, we routinely provide our environmental health officers with both sunscreen and an insect repellent that's DEET approved, and then we get the MSDS sheets and put them in our safety manuals so that if there's a some sort of a reaction or something to that, or somebody, you never know what can happen with it, but we do routinely provide that to our officers.
Okay. All right. So some of the things that we need to think about, if you look at the stinging insects handout, it's just from the NIOSH, and NIOSH is the National Institutes for Occupational Safety and Health. They're kind of the research arm of OSHA that looks at the various possibilities and different things and provides information out there to us. So we've got wasps, we've got bees, we've got mud daubers, whatever you want to call those. They're out and they're about, and we need to be aware that we can't control that. They may come to us, but there are some things that we can do to limit them from being attracted to us. And one of those things is you probably want to wear light colored clothing. If you're out there wearing bright colors, dark colors, they tend to attract to that. Also, you want to make sure that you're not wearing strong perfumes, deodorants, body washes, colognes, those things that might also attract insects. This can be a, you need to make sure that you bathe and clean daily because sweat oftentimes attracts insects. I know if you're out there and you're about and you're sweating and you're doing your job, that's going to attract those little sweat bees. But just think about that. Make sure your personal hygiene is good. Make sure that you're wearing clothing that can cover most of your body. I know I'm a strong proponent of not wearing shorts during the summer months if you're out in the field traipsing around for a variety of different reasons. Make sure that, I know it's going to sound funny, but tuck your pant legs into your socks so that the ticks can't get up there. They still could. Make sure your shirts are tucked in. Wear long sleeves if you can. And then really, I wear lighter colored clothing so that once you come out you may be able to see the tick on you. Another rule of thumb that I often use is, those $2 lint brushes that are like sticky tape. Before you get in your vehicle, roll yourself down with a lint brush. Try to pick up any of those little seed ticks or any little tick that might be on you that you don't see. It's just a prevention measure. It's not going to stop them, but you may be able to get them off of you before you get in your car, and now your car is contaminated with them. And then, you drive your car, you don't go in the field the next day, you get in your car, and then all of a sudden you find a tick on you. So these are just some tips to help maybe lower your chances of having a tick get embedded in you. So I strongly use those little it doesn't necessarily have to be a lint roller. It can be a roll of tape, but and I don't know, some state agencies, their policy is once they find a tick and it's bitten them, that they keep the tick and freeze it. I don't know if you guys do that. Some places do it, some places don't. If you've been bitten by a tick or it's embedded, I would strongly encourage you to file a workers' comp report. We don't know what kind of tick it may have been, what if or when you might get sick. Also, there's a new tick coming up through the Dismal Swamp area. It's causing, and I'm sure you guys could probably talk about it, the Tidewater flu. Have you heard about the Tidewater flu coming up through the Dismal Swamp? It's coming up through the North Carolina. It's a brown tick. Makes you pretty sick if you get it. It takes about my understanding is it takes about 6 to 8 weeks to get rid of it. But we've seen some cases this far north in Richmond, so I don't know if somebody's gone there and gotten some, been palling around out there and brought it back. So for those of you that are near the Dismal Swamp, that's just a new thing. There's been some articles in the newspaper and some other pieces of information out there. Avoid flowering plants if you can, and just think about those things that getting in and out of your vehicles. Dust yourself off, use those lint rollers. It will help, because ticks can stay in your car for a couple days before they expire. So one thing that I see, and we've had some claims, is bees get into people's vehicles and they start trying to swat the bee while they're driving the vehicle. The best thing to do is pull the vehicle over, get out of the car, try to let the bee get out, or open the windows. Try not to swat at the bee while they're in the vehicle. So there's a bunch of different handouts on the stinging insects, venomous spiders. Most of what we're going to see here in Virginia are black widows, some of the hobo spiders, and some brown recluses. Remember, if you get bit by a spider, try to see what type of spider that is and file a workers' comp claim and go through your process and file a workers' comp claim. So we've got a bunch of tick-borne illnesses here in Virginia, and I've provided you 3 different handouts. One is just from the Department of Labor and OSHA regarding Lyme's disease facts. There's also one from, I believe it's your agency, VDH, on preventing tick-borne illnesses. So I hope that you take the opportunity to read it. It's a good piece of information for you. And then VDOT has also put out an advisory that I've provided in the handouts to help you, along with West Nile virus and mosquito bites. So the biggest things for you as employees is to make sure you're doing everything that you can. Wear insect repellent when possible. Make sure that you're covering as much of your body as you can. And really, when you come out of the field, make sure that you're, at the end of the day, that you're checking yourself really good for ticks. Most of the tick bites that I've seen or investigated, most of them are either around the waist, on the upper thigh where the ticks crawled up the pant leg, and under the arms. So think about those dark, moist places. That's kind of where they go, under the arms, around the waist, back of the knees, or tops of the thighs. We have had some in the groin area and in your head. So moist, sweaty places, think about that.
All right, guys, we have Dr. Lori Forlano. She's the Deputy Director for Epidemiology. Take it away.
There's a bunch of people out.
Yes, about 85.
Oh, wow. Hi, everyone. Yep, my name's Lori Forlano. For those of you who don't know me, and I'm not going to spend too much time, but I will, do they have the opportunity to talk to us here? Is that how? Mm-hmm. Yeah, so if you have questions, please feel free to ask. In general, I'd say with Lyme disease particularly, mostly our role at the health department is to educate and to inform and to teach you and the general public about prevention, which I think has kind of already been covered, but definitely utilize insect repellent, long sleeves, long pants, and do tick checks regularly, as you've already been advised to do. Clinically speaking, Lyme disease presents in sometimes a non-specific way. It can be anything from a fever and just general malaise, kind of what some folks would call flu-like symptoms, but also can present with a rash, but not always, which you may or may not be familiar with, erythema migrans, which is what the lay people call the bullseye rash, which is a central clearing rash and can be up to about a foot in diameter. You can get it in places where you might not notice, on the back side of your body, so just keep an eye on yourself if you're outside doing outdoor work. If you have symptoms of a fever or flu-like symptoms, most physicians would tell you within about a week to 14 days after a known tick bite, then you'd want to go back and talk to your doctor about that. We don't recommend really keeping a tick. You certainly can if you want. We do get ticks sent to us occasionally, and we have someone here who would look at it, but I can't say that that's a general recommendation. He can see what species tick it is, and that can help us with what kind of disease you may or may not have been exposed to. Not all ticks carry Lyme disease, only the black-legged ticks do. And the more, I believe our entomologist says, and Julie, correct me if I'm wrong, our most commonly identified tick is not a black-legged tick, it's a lone star tick, which carries other illnesses. So that's really what I'd have to say. You can call anytime if you have questions, or if you have questions right now, I'm happy to answer those. Dr. Julie Murphy is here as well, who's our state public health veterinarian and knows all things rabies. So I think she's going to talk a little bit about rabies.
Hi, I'm Julia Murphy. I'm the state public health veterinarian, and just maybe a few words about rabies if you're out and about and do a lot of work outside. Rabies is a virus that's commonly found in Virginia's wildlife, particularly certain wild animals like raccoons, skunks, and foxes. But I just encourage everybody to remember that any mammal can get rabies, and so we would encourage you to employ some of what we might consider best practices when it comes to avoiding exposure and responding quickly to an exposure when it happens. And when I say exposure, in large measure, many times we're talking about bites. So if you work in a situation where you may happen upon wildlife or animals like dogs and cats, first try to avoid approaching any animal you don't know, and particularly avoid approaching wildlife. We always say appreciate wildlife from a distance if at all possible. If you are bitten, what I would encourage you to do is, or you have some kind of question or encounter with an animal that you think may have exposed you and resulted in an injury that you think may be a bite or something like that, is one, if you think you can do it safely, try to confine or contain that animal before it runs away, or if the animal is a domestic animal that's obviously owned, see if you can get the name and contact information for that animal's owner, and then report that situation to either local animal control authorities or the local health department, so there can be prompt discussion about the situation to see if there's any further concern in regard to the likelihood that you've been exposed to rabies, and if so, especially if we know where the animal is, there could be some action or intervention that the health department or local animal control authorities could initiate to try to help sort out that situation to see whether or not there would need to be any further intervention or treatment for rabies. And the other thing I would mention too in regard to rabies treatment, which is rabies post-exposure prophylaxis, which is a series of, for those who have been exposed and never vaccinated before, a series of 4 vaccines plus a biological called rabies immunoglobulin. What I would recommend for people who work in an environment, and again, your local health department can be a good resource for which individuals may fall into this category. If you're an individual who may fall into one of the ACIP's categories of people who may be exposed frequently to rabies, we would suggest that you are vaccinated for rabies using a 3-dose series we would call the pre-exposure series. So you may want to engage your local health department folks in conversation if you're a person like an animal control officer, licensed veterinary technician, wildlife rehabilitator, and somebody who may, as part of his occupation, come into contact with the rabies virus in some form. You may want to consider undergoing the pre-exposure series for rabies, and your local health department would be able to advise you in that regard. I hope that all made sense. Does anybody have any questions now in regard to rabies or animal bites? Kind of the bottom line is try to avoid being bitten in the first place by not approaching animals you don't know, never approaching wildlife, and then if you are bitten, seek prompt guidance and advice from local health department or animal control authorities, and if it can be done safely, try to capture or confine the animal that bit you or that you think may have exposed you, or at least try to identify that animal before the animal runs away. That can be helpful information for the local health department in regard to guiding you as to what may be the best course of action. And then, of course, if you're a person who we would consider in a more high-risk occupation when it comes to rabies, you may want to discuss the pre-exposure vaccination series with your local health department.
I just want to ask you guys, are we offering the pre-exposure vaccinations to our EH staff or drinking water staff?
Jeff, this is Jan in Cumberland. Our officers do get that vaccine. It's part of our initial employee health assessment when they come on board. So yeah, I can say yes here.
Okay, thanks, Jan.
And again, if you have any questions about the nature of your work and how it may coincide with the recommendations of the document I referred to, the ACIP Human Rabies Guidance document, which can be found on the CDC website, is a document developed under the auspices of the CDC. Your local health department can help guide you as to whether or not it would be recommended you undergo the pre-exposure series.
Jeff, this is Jean in Norfolk. We have a few of our EHS staff who are given that pre-exposure. Not all, but a few that do specific rabies-related work.
Okay.
We have an employee that's bitten or exposed to when they go for medical treatment. Is there some kind of a report that's filed from the attending physician's office with the local health departments, or?
Well, that would be part of your workers. That process sounds like a workers' comp process, right?
Yeah, well, and that's what I'm wanting to know. Like, I think there used to be a thing when I worked in the medical field that when we would have bites come in, they would report it to the local health department. Is that
Right.
still the situation?
Yes, yes. We very much encourage physicians. We very much encourage everyone who's been bitten to report to the local health department, and very much encourage physicians to report bites to the local health department. And then that way the health department can be engaged in whatever follow-up needs to be done. And sometimes animal control is the first responder in that regard, but animal control is then supposed to share that information with the health department so that we can work together to figure out what the best course of action might be, or at least inform the health department if there's a problem during a confinement that would lead to a change in our human health recommendations.
And are pre-exposure vaccines painful?
I would say no more than a flu shot. I mean, if you've received a flu vaccination, my experience would tell me that they're no more painful than receiving an intramuscular injection of a flu shot. You just need 3 of them instead of 1.
Less painful than rabies.
Yes, they are. Like, God bless you, Dr. Forlano. They're much less painful than rabies. The pre-exposure vaccinations, never fear, as compared to actual rabies, are less painful. So I don't know if that's been documented in the literature, but that's personal communication from Lori Forlano. Referenced in my next publication.
Yeah. And I wanted to say one more thing about ticks when you're talking about prophylaxis, because that's a really common question we get from all kinds of audiences. just because you're bitten by a tick doesn't mean it was a tick that can transmit Lyme disease, and even if it is a tick that can transmit Lyme, doesn't mean it has. So we have a bit of the clinical world has a bit of an algorithm there on who we would and would not recommend prophylaxis for, that is treatment with antibiotics prior to showing any signs of illness. It's different if you actually present with compatible clinical signs of Lyme. A physician would treat that differently than someone who's been bitten by a tick but hasn't presented with illness yet. So there are good evidence-based practices out there on how we decide on who's prophylaxed, but mostly what we tell folks is just if you're concerned about a bite that you've gotten, go see whoever your provider is, and they often consult with us. Sometimes they just look for the literature that we use as well.
And another word on that as well, kind of echoing some of the things that have just been said, a tick will need to be attached to you for a certain period of time before it can transmit disease, if it's even infected with that disease. Because not all, say, black-legged ticks, if you test them, will test positive for Lyme. Some of them will not. And that tick needs to be on you. Any tick needs to be on you for a certain period of hours before it can actually transmit the pathogen that it may have inside of its gut. So trying to avoid being bitten by using repellents and other things as directed. Permethrin, DEET are often repellents that are suggested. And then checking yourself often and removing ticks if you have any on you frequently will really help decrease the likelihood that you'll ever become ill, even if that particular tick was infected with a pathogen that can make you sick. Mm-hmm. So that's a great thing to remember.
Dr. Murphy. Hi, this is Jan Trent. I'm in Cumberland Plateau. Our officers are pretty much generalists, and they all get the rabies pre-exposure vaccine. I occasionally see the titering labs coming through. Can you tell me what the recommendation is for that? How often that should be done, and should I be having the employee health nurse check that annually, biannually? I'm just not familiar with that end of it enough to make that recommendation.
The ACIP guidelines would suggest that anybody who falls in what's called the frequent risk category, which would be folks like veterinarians, licensed veterinary techs, animal control officers, and I would put forward environmental health specialists that help to process rabies samples, have their blood drawn for an antibody level check every other year, so every 2 years.
Okay, great. Thank you.
And remember that assessment of neutralizing antibody level should be done by the Rapid Fluorescent Focus Inhibition Test, or the RFFIT. There are only 2 laboratories in the country that perform that test, Kansas State University and Atlanta Health Associates. So that's the testing we need done for our purposes to be able to interpret them for public health purposes as to whether or not somebody needs a booster vaccine. So remember, that's the specific test that should be done.
Okay. Is there a written protocol for us to be able to follow to make sure that our employee health nurses have that? I am not 100% positive that's being done every 2 years with our officers here.
Well, what we reference, if you look in the Virginia Guidelines for Rabies Prevention and Control, which is available on our website, so that's vdh.virginia.gov, and if you go to, use the alphabetical index to access the subject under R, rabies control and statistics is the first menu option that you find under the R's. If you click on that, you'll get to our rabies control page, and on our rabies control page, you will find a menu option for the Virginia Guidelines for Rabies Prevention and Control, and it's on page 11 of the Virginia Guidelines for Rabies Prevention and Control. Not that I'm familiar with the Virginia Guidelines for Rabies Prevention and Control, that you will find. I think it's page 11, 12, around in there, that you will find the links to not only recommendations but links to the websites for the Kansas State Rabies Lab and the laboratory known as Atlanta Health Associates, which is in Cummings, Georgia. They perform the RFFIT, which is the test we recommend using for public health purposes. And then also on our rabies control page, you will find a link to the CDC's ACIP Human Rabies Prevention document. In there, you will find a table, I don't know what page, of categories of individuals for whom the rabies pre-exposure series is recommended. And in that table, which is in the ACIP guidance now, it will list in that table how frequently those folks should have a titer checked. There are people that we recommend have titer checks done more frequently. I believe it's every 6 months. Those are for people who really are categorized in what we would call the continuous exposure category. That's really not ACOs or veterinarians or LBTs. So typically for our purposes, it's pretty routine that we recommend titers done by the RFFIT every other year, and then boostering in accordance with the ACIP recommendations. And then, of course, anybody who has ever been pre-exposure vaccinated, if those folks are ever categorized as exposed, they need post-exposure prophylaxis, but that is different than their post-exposure prophylaxis regimen is different than someone who has never received rabies vaccines before. And their post-exposure prophylaxis regimen is 2 vaccines 3 days apart. That's all they need for folks who have received the rabies vaccine series before.
I think that the take-home message there is that if you're a person who's received pre-exposure, it doesn't replace the need for a post-exposure intervention, and they should be made aware of that.
Correct.
The dosing and the number of vaccines is different, but the need for post-exposure still exists.
Right. If you're exposed to rabies, you always need something in the way of vaccination,
It's
or
different,
something that comes via a needle.
Yeah.
That something is going to be different depending on whether or not you've received rabies vaccinations before or not. But you will always need some amount of vaccine and boostering if you're ever exposed.
I think we try to drum that message home, because with other vaccine preventables, if you get your shot for measles, you're good to go, basically, even if you've been exposed. But it's not the same for rabies.
Correct.
So just making sure that they understand that vaccines
Right.
are
Making sure
slightly
that people for rabies vaccines, it doesn't make you bulletproof.
Right.
If you're ever exposed, you still need to report that exposure, or if you're ever concerned that you may have been exposed, you still need to report that exposure and have that discussion. And then if you're assessed as exposed, you will then still need some booster shots, even if you've been vaccinated before. Sometimes people get confused and they think that a good titer means that they're fine regardless of any exposure. And we would encourage people not to think that way, to still report exposures, discuss the situation, and receive guidance from the health department as to whether or not they need boosters.
Awesome information. Thank you very, very much.
Just give us a shout out if you need it.
While we're talking about rabies, as far as the work comp side, if you are bitten by a dog and you know who the dog belongs to, in that third party, please fill out the information in the visual liquid web.